Many COVID patients feel better after a few days into their hospital stay, and they gain confidence that they're feeling better and that they see the light at the end of the tunnel.
The COVID Care at Home program allows these patients to recuperate in the comfort of their own bed, surrounded by family.
It's a really unique program that we put together that really encapsulated care being wrapped around the patient in the community. So, and it brought our partners together. So when we discharge patients, if they required oxygen, and really 70% of the patients went home with oxygen, which is quite a high number. And out of that, we then would bring care in, which is our home oxygen provider, respiratory therapists in the program that would monitor them and continue to monitor them in the community. They would have a oximeter that we would give them so that they could continue to track their own oxygen. But we had nurse navigators and respiratory therapy navigators from the hospital that would call them daily to make sure that they were okay and would monitor their SATs.
These checkups are vital to reassure patients who have concerns upon leaving the hospital.
Generally, patients are concerned about getting sick again or spreading the illness to household members. And we make sure we tell patients that they're no longer an infectious risk to others when they aren't, and ensure that they are clearly in the recovery phase of their COVID illness so that they don't have to worry about getting sick again.
So some people are more affected and they could have been in the hospital for maybe a few weeks or even a few months. So some of them can become very deconditioned. They could have developed complications from COVID-19 pneumonia. So there are definitely physical barriers. And that's why we send them home with home monitoring equipment, especially an oximeter, so they can monitor their oxygen level closely. Sometimes, in fact, often you can't tell, even though you might be short of breath, you're not really sure what your oxygen level is. And by having an oximeter, they can look at it and it tells them a number, and that will give them a reference as to whether oxygenation is adequate or not. And obviously, if oxygenation is not adequate, then something needs to be done. But most of the time, oxygenation is fine, and that gives them the confidence that they are stable.
Recognizing that patients may have concerns after hours, they've created a 24/7 access to care call line.
And if they needed services after the hours of sort of 8 to 5, then our community paramedicine group would go out and actually do a physical in-home assessment. It could be 3 a.m. in the morning, and they would go in and actually do that assessment to determine if they needed any additional services rather than coming back to our emergency department. And giving them that call number, we were able to reduce a lot of their anxiety around just managing their care at home. And we did a lot of education with their family or support that they had in their home so that they also were well educated around what to do.
By implementing this program, they've been able to send 250 patients home, and so far there have been no readmissions.
We're saving a lot of resources that can be utilized for other patients. And that's why we've been able to help out other hospitals. We've been having a lot of transfers from hospitals in Mississauga, Brampton, even Toronto, to help them out because they've just been overwhelmed.
All of us here at the hospital get a lot of joy when we are able to bring a patient to a point where they can go home. And this program enables us to do that faster. And it's empowering to patients as well, too, to know that there's this program around that can help support them in their recovery. So it's not just bye, we'll see you later, or we'll never see you again, but bye, we wish you all the best. And we're going to keep, holding your hand as you enter back into home, because COVID is still a frightening illness for many people. It's probably one that has shaken the entire community and country and the world. And when we can just provide that extra level of support to each patient as they are embarking onto the next phase of their illness, patients do feel a lot more supported and better.
Reporting for Halton News, I'm Nikki Wesley.